In this guide, I'll cover the key science of skeletal development, and I'll begin by taking a layperson's perspective on a high-profile neutering study. Now, I'm researching my high-risk puppy who's a Bernese Mountain Dog. He's a good example because his breed is ranked #1 in most studies on elbow dysplasia. They're also predisposed to hip dysplasia and cruciate ligament injuries. Now, this paper's open access, so I'll browse until I find the content that's relevant to me. I'll learn that Bernese Mountain Dogs are singled out as high risk. I quote, "Neutering males any time prior to 2 years of age was associated with a significant increase in at least one joint disorder to 23 to 24%, about a 6-fold increase over intact males. And the suggested guideline for neutering males is delaying neutering until well beyond 2 years. Now, I'm a conscientious pet parent, so I'll take this advice seriously. After all, the best way to manage elbow dysplasia is to prevent it, and I now believe that I have a better chance of preventing elbow dysplasia if I delay neutering from 1 year until well beyond 2 years. Now I'm going to hit pause because I need to tell you what makes me an expert in this subject. After all, I'm discussing the risks and benefits of an operation that I don't perform. So here's a brief summary of my personal experience, which you're very welcome to skip past. Now, I qualified in 1997, and I promised that above all my constant endeavour would be to ensure the health and welfare of animals committed to my care. Now, that promise guides every professional decision that I make. I spent my first 2 years working as a veterinary anaesthetist because I was especially interested in alleviating animal pain. Then I worked in general practice where I did perform neutering surgery, and I also neutered stray dogs and cats in an Australian rescue shelter. So I have performed neutering surgery, but I worked exclusively in specialist practice since 2004, initially as a surgical resident, then as a lecturer, and currently I'm a locum orthopaedic surgeon. Now, I qualified as a specialist in 2007, and my governing body, the European College of Veterinary Surgeons, they specified that I must publish at least 2 papers. Now, all ECVS specialists must do this, but clinical research turned out to be one of my strengths. So to date, I've authored or co-authored over 50 papers and book chapters. Now, my first published study tracked the progress of 74 dogs with hip dysplasia. Now, at the time, it was widely believed that young dogs with painful hip dysplasia would almost always recover completely or nearly completely. Now, ours was the first study to show that in reality, long-term clinical signs are typical. Now, we found that most owners mistakenly attributed their dog's reduced exercise tolerance to old age when it was actually due to pain. Now, this was an important study because it highlighted the widespread problem of untreated chronic pain. Now, then in 2014, my research team studied 317 Labradors with chronic pain caused by elbow dysplasia. We learned a lot. For instance, we found that 1 in 5 dysplastic puppies already had severe elbow arthritis before 1 year of age. And we learned that for every 1 month increase in age, there was a 1.6% increase in the odds of severe elbow arthritis. In 2018, I authored a book chapter on canine knee problems, including cruciate ligament injuries, patelloluxation, and OCD. And then in 2020, my research team studied the natural progression of patelloluxation in 38 dogs. Now, we found that half of the dogs with asymptomatic grade 2 patelloluxation would ultimately develop clinical signs later in life. In 2022, I published a review article on the relationship between exercise and developmental joint disease in puppies. Now, every scientific paper requires context, so we must review other research as well as our own. And these 5 examples required a review of 246 relevant research papers, case reports and book chapters. So skeletal development is where my knowledge is strongest, and it's this subject that's been plagued by some of the most pervasive myths in veterinary medicine. So back to our growing Bernese mountain dog. When will he be skeletally mature? Now, before we can answer this question, we need to define skeletal maturity, which is the point in time when the size, shape and mineralization of bones can no longer change. Skeletal growth, which is typically illustrated by these growth curves, begins at birth and finishes at the end of adolescence. Now, by definition, developmental joint diseases develop during the rapid growth phase, which is also called the growth spurt. Now, it's important to know when the growth spurt is complete, because events which occur afterwards cannot affect events which occur while it's still happening. Now, some very thorough research gives us valuable insight into the canine growth spurt. In the 1970s, veterinary researchers were far ahead of human healthcare researchers in the field of skeletal development. So in 1973, the National Institutes of Health funded a veterinary study which showed that in large breed dogs the growth spurt was over by 7 months. Now, this is when the longest bone in the body, the femur or thigh bone, reaches 95% of its maximum length. Now, we know this for certain because the dogs in this study were x-rayed every day for the entire 7 months. Now, this is a study of greyhounds who are classed as a large breed dog, but subsequent research mapped growth in larger breeds, and that research showed that their growth also dramatically tapers after 7 months. But the paper we just met suggested that neutering Bernese mountain dogs at 1 year put them at risk of joint diseases that develop before 1 year. Now, how is this possible, since neutering must come before joint development to affect joint development? Now, the only way for neutering after maturity to cause conditions that develop before maturity is for time to run backwards, which is impossible. So how can we make sense of this study's results? Well, there's a surprisingly simple explanation. Imagine we're trying to estimate the average salary for computer programmers. We recruit a sample group of 3, but one of them happens to be Bill Gates. Now, the average salary gives us the false impression that all 3 programmers are multi-millionaires. They're not, but they look like they are because the 3rd programmer is a multi-billionaire. Now, a similar thing happened in the University of California's neutering studies. The developmental conditions, i.e. hip dysplasia and elbow dysplasia, were grouped with a 3rd condition, cruciate ligament injury, which typically develops in mature dogs with an average age at diagnosis of 6 years. So neutering at 1 to 2 years usually precedes the injury. Now, of the 35 breeds in this paper, only Bernese mountain dogs and German shepherds had an increased risk of joint disease if they were neutered after 1 year. And for both breeds, neutering at this stage did not increase the risk of hip dysplasia or elbow dysplasia, but neutered dogs were more likely to be diagnosed with a cruciate ligament injury later in life. Even so, some people still argue that neutering should be delayed until 2 years to protect developing joints. Now, why is that? The most plausible explanation is a tendency to close ranks around our favourite breeds. Now, we see them as exceptions to the rules that apply to other breeds, especially if they're giants. The largest breed in this study was a group of 353 Great Danes, who despite their rapid growth rate had no increased risk of joint disease, cancer or urinary incontinence after neutering at any age. I quote, "Those wishing to neuter should decide on the appropriate age." So skeletal development of the fastest growing breed is not affected by neutering. How did the authors explain this apparent paradox? They didn't. I quote, "Given the large body size and physiology of late musculoskeletal development, neutering well beyond 1 year should be considered." Now, the author's advice to disregard their own findings is unscientific, especially because their findings can be easily explained. Compared with other breeds, Great Danes are experts at maintaining lean body mass. In this study, Danes, Labradors and Papillons consumed strict calorie-controlled diets. Danes remained leanest as they aged, averaging only 10.5% body fat. Papillons averaged 14.8%, and Labradors, perhaps unsurprisingly, topped the charts at 15.7%. Many studies show a strong relationship between overweight status and joint disease, including this one, which showed that overweight dogs are 4 times more likely to injure their cruciate ligaments. So in summary, we know neutering can increase the risk of cruciate ligament injuries later in life. But we also know that neutered dogs burn fewer calories than intact dogs. And if we don't adjust their calorie intake, they'll gain excess body fat. Now this triggers chronic low-grade inflammation, which can in turn trigger cruciate ligament degeneration. So the true culprit, once again, is excess body fat. Over the past 2 decades, more and more dogs are suffering cruciate ligament injuries, and we need to reverse this trend. How do we do it? By taking the obesity epidemic as seriously as the potential risks posed by neutering.